Everyone. My name is Professor Eileen Gibney, and I'm Director of the UCD Institute of Food and Health. And this evening, I'm delighted to welcome you all to our second talk in the public lecture series for 2024. The purpose of these within the Institute is to provide you with really up-to-date scientific knowledge on topics of food and health that we know are of interest to the public. So really trying to take what we do on a daily basis and talk about it with you as the public and share information. So tonight's lecture is a very interesting topic of One Health, a healthy society for all. And we have two speakers this evening, Professor Paul Whyte and Dr. Tony Holohan. So Professor Paul Whyte graduated from UCD with a degree in industrial microbiology, and then went on to complete a master's degree in food science. He then went on to complete a PhD and has been working within academia since. He's responsible for the delivery of veterinary public health teaching within veterinary medicine degree program in UCD. And he's been appointed to various committees, including the FSAI, Animal Health Ireland, and the Department of Agricultural, Food and Marine, and work within there. So his research interests really include characterizing and assessing risks associated with biological hazards in food animals and foods of animal origin, and applying risk mitigation strategies to reduce those risks and evaluate the effectiveness of those, particularly at farm and processing levels across the food chain. Dr. Tony Holohan is a graduate of UCD School of Medicine also, and since he graduated, he moved more into the public health side and has spent his career working to bring about meaningful change and better healthcare within the Irish healthcare system and broader. In his role as Ireland's Chief Medical Officer, Tony has led the nation's response to COVID-19. And since he stepped down as Chief Medical Officer in 2022, today Tony talks about, I suppose his role in that. He's now an adjunct professor at public health at University College Dublin and is co-director of the UCD One Health Centre. So we're going to have a really interesting talk between these two speakers today. So if you have any questions, you need to add them to the question and answers tab that you will see at the bottom of your screen. And after our two speakers have finished, my colleague, Professor Lorraine Brennan, who is here, will moderate the question and answer session. So we look forward to hearing all of your questions that you may wish to pose. So do remember to type them in and we'll try and remind you as we go through the talk. So I'm delighted to welcome both Paul and Tony, and I'm going to hand it over to Tony now, who's going to kick us off for today's lecture. So Paul, if you don't mind sharing the first slide, and then Tony will be able to speak on that. Thank you very much.
Great. Thank you very much indeed, Eileen. You can hear me okay? Can I check first of all?
Yes, we can indeed. Yeah.
I'm having little problems with my video. Apologies for that. So good evening, ladies and gentlemen, and thank you, Eileen, for that introduction. As you said, my name is Tony Holohan. I'm now Adjunct Professor of Public Health in the College of Health and Agricultural Sciences in UCD. And it gives me great pleasure to speak to you all this evening as part of this public lecture series. And I'd like in particular to thank Professor Lorraine Brennan, who's joining us this evening, who's the College Vice Principal for Research, Innovation and Impact in the UCD College of Health and Agricultural Sciences, for the invitation. And it was a privilege for me to have been appointed to the position of Adjunct Professor in July 2022. And in this context, I particularly thank Professor Cecily Kelleher of the College, she is the Principal. And then in 2023, I was appointed as Director of the now established new Centre for One Health, about which I'll be talking in a moment, in the College of Health and Agricultural Sciences. And this builds, as many people will know, on a proud track record here in UCD in relation to One Health. In this regard, I want to acknowledge my colleagues who work closely with me in this agenda, and in particular, Dr. Gerald Barry from the School of Veterinary Medicine, who is Deputy Director of the Centre for One Health. So I'd like to, this evening, introduce the concept of One Health, what it is, what it means, how it fits into other major issues for us as humans and as a society, and maybe a little about how I came to be involved in it. So first of all, what do we mean by One Health? Well, One Health is about understanding how the health of people, animals, and the environment are connected. It's like realizing that everything is linked together in one big system. And this means that to solve problems, we need to better understand their complexities. So if there's a problem in one part, like when animals become ill, that can affect other parts, including humans and the health of humans. And so when we talk about One Health, I'm effectively saying that doctors, vets, environmental experts, and many others, as I'll come on to describe, need to work together, each bringing different knowledge and skills to the table. And working as a team, they can tackle issues that we confront together more effectively. So at its heart, One Health is a way of thinking that should guide us how we as a global community can approach challenges. And it reminds us to consider the health of humans, of animals, of plants, and the wider environment when we make any of our plans. And it also suggests that if we don't do this, we may fail to prevent health risks, fail to prevent or to improve rather health outcomes, or to protect the planet's future. And even though when expressed in these terms, One Health may sound simple, it's not put into practice as it should be. Many people, organizations, and countries don't fully understand what it means or how perhaps to use it in real situations. And this can hold back efforts to make local, national, and global plans work well together. But that is changing. As some people will know, in late 2022, the 4 global UN organizations, that is the Food and Agriculture Organization, the United Nations Environmental Programme, the World Organization for Animal Health, and the World Health Organization together published an agreed 5-year quadripartite action plan from 2022 to 2026 to drive the change and transformation that's required to mitigate the impact of current and future health challenges at the human, animal, plant, environment interface at global, regional, and also at country levels all around the world. And that quadripartite plan outlines the commitment of those 4 organizations to collectively advocate for and to support at all levels across the world in the implementation of One Health. It builds on and complements and adds value to existing global and regional One Health coordination initiatives, which are aimed at strengthening capacity to address complex multidimensional health risks with more resilient health systems at global, regional, and also at national level, as I've said. In UCD, our analysis is that there is not enough opportunity for professionals to learn about One Health, and that perhaps there is insufficient research that crosses different areas of relevance to One Health, and that's true right across the academic world. And this was the driving motivation in UCD for establishing the Centre for One Health. A particular view we have is that we need to find ways in which disciplines that perhaps have not traditionally been involved with us on the agenda of One Health, such as, for example, communications or behavioral economics or social sciences more generally, can become involved. And for me, this is a key learning in the pandemic. We needed every potentially relevant perspective to be brought to bear on the challenges and solutions that we had to find. And so it is with One Health. Without such a broad view, we will struggle to address complex issues at the global level and to tackle health threats like pandemics effectively. A One Health approach means engaging with new disciplines, collaborating across sectors, building capacity, influencing policy, and advocating for health in all its dimensions. Therefore, we need experts from different fields to work together more closely. And that means bringing together people with knowledge in biology, in politics, in business, in behavior, in history, in technology, and many other areas. And collaboration across these disciplines and sectors is crucial for creating policies that can truly make a difference. And perhaps a little about why someone with a public health background like myself becomes interested in something like One Health. Let me use the analogy of a flowing river. Imagine a river rising in the hills. It flows downhill through countryside, through villages and towns. It's joined by other tributaries. It grows as it goes, and people have to cross it, use it to travel, to power mills, to water fields. In bad weather, the river can flood, can burst its banks and wash homes and villages away. And while a river will bring life, people do fall in or get washed away, and some of these people may drown. And so it is with health and illness. People fall into ill health and need to be, as it were, saved. Numbers can change like a flooding river as a result of pandemics, or perhaps the rising rates of diabetes we're currently seeing driven by obesity. Many tributaries upstream contribute numbers to the total number of ill health, depending on their course and their individual source. And as a doctor in clinical services, you're trained to save individual people who've perhaps fallen into the river as best you can. And as a public health doctor, you're trained to think differently. You're trained to think of how fast the river flows, its tributaries, how wide they may be, how long the course may be. And you're trained to understand why people are falling into the river in the first instance and how best to prevent them from doing so. So at a relatively early stage in my career, I chose to pursue a career in public health. Although I completed my training as a general practitioner, I was interested in wider questions of policy, of health inequalities, of disease patterns, and other factors which I felt less able to influence as a GP. I went, as it were, upstream. So let's take this river analogy to go upstream to think about the factors that shape human health and why it's important to take a broader view of it. The WHO defines health in positive terms. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Good health and well-being are a key goal among the 17 UN Sustainable Development Goals. In this context, health and well-being are essential assets for happiness, for fulfillment and personal growth, as well as vital resources for sustainable economic productivity and social functioning, both for individuals and for society as a whole. We therefore need to see investments in health, in education, and in social development as investments in our collective well-being. And our perspective should be that the economy should exist to serve our well-being as human beings, and not the other way around. If mankind is to protect human well-being and health from threats such as pandemics, or perhaps obesity, or antibiotic resistance, we need to better understand the links between our well-being and the health of the planet and all its plants and animals. In particular, we need to understand how the functioning of our societies and economies have a determining effect on human, animal, and planetary health. Policies across the world that are designed to fundamentally improve health and well-being and reduce inequalities come back to the same things: the importance of maternal health, the importance of health in pregnancy, the importance of health in early childhood, access to education, access to opportunity, and the fair distribution of resources. And perhaps we do not have the conversations as a society that we should be having about sustainability, about well-being, and about inequalities. And I'm therefore happy to be part of this evening's attempt to address that. Climate change, energy distribution, water scarcity, biodiversity loss, conflict, and migration all impact our collective health and well-being. A One Health approach frames health in a wider systems context and it promotes actions that reflect the interconnectedness of these global issues. The river analogy I spoke about earlier works well for thinking about COVID-19. Here was a new disease, much more transmissible than influenza and more severe. There were no drugs to treat it, no vaccines to prevent it, and no natural immunity from previous viral variants. Focusing on downstream issues like building more hospital beds or ICU facilities alone would not protect people sufficiently. We had to try to reduce the risk of getting the illness, to reduce the size of, as it were, the flood of infection, and to buy time for science to develop vaccines and treatments. All we could control, or perhaps influence, was the speed at which this disease was transmitted, if we could influence human behaviour. The COVID-19 pandemic made clear that many assumptions and perhaps implicit wisdoms on which modern societies, economies, and healthcare systems are based are flawed or false and are entirely unsustainable. It saw a rapid spread of the virus in a tightly coupled global economy, characterized by cohorting of the most vulnerable people in our societies, population density, and deepening interconnectedness through globalized commerce, geopolitics, travel, and migration. The prevailing focus of many countries, including ourselves, on GDP growth often comes with limited understanding of its wider ramifications. It can prioritize short-term gains over long-term sustainability and well-being. And this is harming our environment, the health and welfare of animals, and it's exacerbating inequality. Such a narrow economic focus can cause us to categorize spending on education, on healthcare, on infrastructure, and essential social developments as costs for our present rather than investments for our future. We all know that the people who come from societies or populations with the greatest health needs are also the very ones who have the greatest challenges in access to health services. Many of these same people experience exposure to the impact of inadequate sanitation, poor nutrition, environmental degradation, hazards and dangerous living conditions, often due to systemic discrimination or socioeconomic disparities. And if we could level up these experiences, we would make a very significant contribution to the overall health and well-being of our population. The pandemic made these inequalities very real. Yes, we know the cause of COVID is a viral infection caused by the virus SARS-CoV-2. But the major burden of morbidity and mortality that occurred around the world was driven by inequality, whether in terms of age, ethnicity, underlying illness, living conditions, or socioeconomic status. COVID-19 is an example of what we call a zoonosis or zoonotic illness, which means one which has come to us human beings from animals. And a One Health approach offers much to how we can better prepare for dealing with such events in the future. Professor Paul Whyte will speak to you shortly about zoonoses. We know that many people impacted by these zoonoses or zoonotic illnesses are disproportionately affected due to factors such as limited access to healthcare, poor sanitation, or proximity perhaps to pathogen-carrying animals. So we are one world, and the purpose of One Health is to help us to realise that and take actions that recognise this. And through the step of setting up the Centre for One Health, UCD aims to build a national collaboration with other universities, with government agencies, with industry, and all relevant stakeholders, and thereby make a contribution to addressing the growing challenges that face us in the modern world. I want to thank you for joining us this evening and taking an important action in your own One Health journey. And I'll now hand over to Professor Paul Whyte from the School of Veterinary Medicine, who, as I've said, will speak to you about zoonotic illness, and I'll be staying online to answer some of your questions. And thank you most sincerely for your interest and for joining us this evening.
Thank you, Tony. I'll just get myself set up here now. Oops. Yeah, so hopefully you can see the slides. Yeah.
Yeah, perfect. Thanks.
Excellent. So thanks, Tony, and good evening to everyone. And thanks again for joining us for our session on One Health. And I'd just like to take the opportunity to thank the UCD Institute for Food and Health for inviting me to talk this evening. So Tony has given a very good introductory talk on One Health and the big challenges and burdens of disease out there and so on. And what I want to focus in on now are just to give you an introduction or a flavour to zoonosis and zoonotic diseases and their impact on human health. So essentially over the next 15 minutes or so then, just One Health, the concept, what is it? Very briefly, Tony has covered that. A little bit on what are zoonoses, how as humans we tend to be most likely exposed to these pathogens, the impact of zoonosis on human health. And then I thought I would spend a little bit of time then just showing you how we might actually try to manage risks within, as an example, a specific food chain, primarily at primary production or farm level through processing and production of products, food products, okay? And I'll just end the presentation then on a kind of a positive note then with a single slide just to show you that veterinary public health is not all about the negatives associated with animals. There's a lot of positives associated with our interactions with animals and so on. Okay, so One Health then, as Tony has mentioned, it's basically a triad or three pillars. And it's basically the relationship or interplay between the health of animals, the health of people, and the health of the environment. And my own background then within veterinary public health, I have a particular interest then on the impact of animal health and its influence on environmental health and all of the potential contamination and zoonotic pathogens that can be offloaded by animals into the wider environment. And us as humans then can be exposed to a contaminated environment. And then also, direct contact with animals and the impact on human health and foods of animal origin and so on that we consume that might be contaminated with zoonotic agents causing us to become sick. So the World Health Organization has defined One Health then as an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. And it's particularly important to prevent, predict, detect, and respond to these global health threats, as Tony has mentioned. So that's just a very quick overview of One Health and our definition of it. So what are zoonoses then? It's any disease or infection that is naturally transmitted from vertebrate animals to humans. And we're typically talking about bacteria, viruses, and parasites or protozoa, and sometimes fungal infections as well. There are over 200 types of zoonotic pathogens or agents that have been characterized. And zoonoses comprise a large percentage of new and existing infectious diseases in humans. Okay, so essentially these zoonotic agents can circulate within animal populations. Very often they can jump between different animal species, and some of those then can get through and we can be exposed to them from animals either directly or indirectly through contact with animals. And some zoonotic agents then, and I've just given you an example there, such as rabies then, are preventable through, vaccines or very effective controls exist in terms of limiting disease or preventing disease in humans. So how are zoonoses then transmitted to humans? So there's essentially 6 main kind of pathways. So there's our direct contact with infected animals or carrier animals. There's indirect contact, so animals that have contaminated the environment and we then come in contact with that contaminated environment and inadvertently are exposed to some of these zoonoses. Vector-borne, so things like ticks and mosquitoes can sometimes carry some of these zoonotic agents and transmit to humans from initially an animal reservoir. Okay, and then there's obviously foodborne transmission to humans, and that would be a very, very big cause of burden of disease in humans, and also something like waterborne. So again, animal waste contaminating water supplies, and water then becomes a very good means of disseminating infectious disease to humans. And also, you can get kind of a person-to-person spread. So once the initial jump has occurred from animal to human, you can then, in some instances, get person-to-person transmission being possible. And Tony has already mentioned COVID. Another example would have been HIV, which was original reservoir would have been in animals, and then it was able to jump species into humans and start to actually transmit from person to person. Okay, so that's just the main transmission routes. So I thought I'd just give you a couple of examples then for some of the main transmission routes then. So direct contact with animals. So very often we're talking about possibly occupational exposure here. So things like farmers or vets or anyone that has direct contact with animals kind of on a kind of a frequent basis. So avian flu, so things like droplets or fomites associated with infected, very often symptomatic animals can transmit to humans that have close proximity to those infected animals. So there have been some cases documented, for example, with farmers or farm personnel tending to flocks that are affected with avian flu. And there's actually an outbreak unfolding at this very moment in time on a multi-state outbreak in the USA associated with dairy farms, where some of the cows have become infected with avian influenza. And I think some of the farm cats we've found avian flu in them. And several people working on those farms have also developed symptoms associated with the avian flu. Okay, so that's just one very topical, up-to-date example. So rabies, direct contact. So if you've got a carrier dog and you get bitten, there's obviously a risk associated with transmission of the virus to the human. And brucellosis would be another example. And that historically here in Ireland, that would have been quite a significant player. And essentially, it can be associated with calving or aborting cows that are infected. It can be a cause of abortion actually in cows. And the bacteria then can gain entry to us through direct exposure and ingress through mucous membranes or maybe cuts or abrasions, and also through consumption of contaminated milk from infected cows. Okay, and that has implications then in terms of unpasteurized its consumption or dairy products made from unpasteurized milk. Okay, what about indirect contact with animals? So we're talking primarily about environmental exposure here, and some examples here would be leptospirosis, and that would be associated with rodent urine and reproductive fluids. Okay, so we're indirectly coming in contact with the animals and making contact with contaminated urine or reproductive fluids. E. coli, I've just given an example. So most E. coli tend to be relatively harmless to us as humans, but there are certain subgroups of E. coli that can cause quite severe disease. And the one particular group would be referred to as enterohemorrhagic E. coli, and 0157 is a serotype within this group that has been associated with very severe disease in humans, and it tends to be associated with ruminant species, so cattle, sheep, deer, goats, and so on, and it's shed in the feces of these animals, contaminates the environment, survives well in the environment, and we can be exposed then through a contaminated environment or through ingestion of contaminated water and so on. Okay, and then listeriosis, a whole load of different kind of potential animal sources. Again, survives very well in the environment. It's found in soil, vegetation, and so on. It can cause abortion in pregnant women. It can cause flu-like symptoms. It can also cause much more severe kind of septicemia in more severe cases in humans. And in past outbreaks, about 30% mortality rates have been documented. So it's a very, very serious pathogen. Thankfully, we don't get many cases, but when it does strike, the consequences can be catastrophic. Okay. What about vector-borne? So this, I've just given you some examples here. Lyme disease, again, there would be some cases of Lyme disease here in Ireland, and it is tick-borne. And particularly in Ireland, it's associated with deer, wild deer, that can harbor the bacteria causing Lyme disease, the Borrelia species. And the ticks feed off the blood from the deer. They inadvertently ingest some of the bacteria, and then they might actually move on to a human host, burrow into the skin, start gorging on our blood, and introduce the bacteria into our bloodstreams, and we could become infected that way. And typically, with this picture up here, what you would see associated with Lyme disease is this kind of red rash appearing around the site of the bite. Okay, and again, the symptoms can be very severe in terms of, and prolonged. Okay, so you might be talking about fevers, chills, kind of chronic fatigue, muscle joint and pains and headaches and so on. And it can last months, even longer, in terms of the disease. And it tends to be very, very hard to diagnose. So people that get it end up with very, very severe symptoms that can go on for a long time, even before the condition is diagnosed and a proper treatment can be initiated. And another example of a vector-borne disease, this time it's carried by mosquitoes, is dengue fever, and it's a viral agent This guy here, Aedes aegypti. It's staggering, really, when you look at the statistics. Approximately 4 billion people on the planet live in high-risk areas where dengue fever is kind of endemic, okay? And thankfully, thus far, it hasn't been detected in Ireland to date, but maybe mosquitoes and mosquito-borne disease will become an issue here in Ireland in the future, and the carriage of mosquitoes and the ability of mosquitoes to be able to survive in our climate in the future. So again, in terms of One Health, it kind of highlights the importance of ongoing monitoring and surveillance to make sure that these new diseases aren't migrating. And if they are, and they do arrive here, then that we have a plan to try and limit and control their impact on human health here. Okay, and then, you know, my main area of interest is actually foodborne disease and zoonotic transmission through the food chain. So foods of animal origin are obviously very, very important and can be quite frequently carriers of zoonotic agents. And as Tony had mentioned in his talk as well, you'll get most cases of zoonotic disease. You'll see most cases probably in developing countries or poorer countries, where probably zoonotic diseases are more endemic in animal populations. Regulatory controls and controls within food chains aren't as well regimented. You've poorer sanitation, you've poorer healthcare systems, and so on and so forth. So there's a whole load of reasons at play, but a big proportion of the burden of zoonotic disease is probably in developing countries. And the foodborne transmission, you know, there's a lot of it here in developed countries as well, whereas some of the other transmission routes will be more important in developing regions. So just a couple of examples then. Salmonella, so we all know, or at least have heard what salmonella can cause foodborne disease in us. It has a wide kind of animal host range. It's common in livestock and poultry, reptiles, wild birds, rodents, and the transmission is primarily kind of fecal-oral route. So contaminated feces from animals contaminating foods of animal origin, or indeed foods of plant origin. And it typically causes kind of gastroenteritis in humans, and occasionally more invasive or severe infections in kind of more vulnerable kind of subgroups of the human population. And it can cause things like septicemia and much more severe kind of symptoms. Campylobacter would be another example. It would be a very prominent kind of foodborne zoonosis, and it would be associated with particularly poultry. Okay, so approximately 60% of chicken carcasses that end up on supermarket shelves would be contaminated with Campylobacter bacteria. Okay, and it's actually the most common bacterial cause of food poisoning in the EU in humans. All right, and I mentioned these guys here, these E. coli 0157, in the context of environmental exposure. Well, it's also a very important pathogen in terms of foodborne transmission as well. So you've got these ruminant species being the reservoir, contaminated feces, contamination of meat, milk, water, and the environment, and indeed plant-based foods. So there have been large outbreaks associated with contaminated water or runoff ending up on crops in the field. And a lot of plant-based materials that we consume would be uncooked. Okay, so there's obviously a risk with contaminated plant-based foods as well as foods of animal origin. And these can cause very severe illness and deaths in humans. You know, the spectrum of disease associated with these enterohemorrhagic E. coli would vary from, or range from very mild disease up to and including deaths or life-changing injuries and damage to kidneys and so on. Okay, so just a little bit then, and again, this is a statement from the World Health Organization, the impact of zoonotic disease on human health in a global context. And they're saying that 75% of new diseases that have affected humans over the past 10 years have been caused by pathogens originating from animals or products of animal origin. And many of these diseases have the potential to spread through various means over long distances and to become global problems. So that has certainly hit home in the last few years with the likes of COVID, for example. Okay. And again, just to put in context then, the kind of global impact of zoonotic disease on human health, they've put together kind of a top of the pops, if you like, the top 13 zoonoses that are reported globally. So it ranges a range of parasites, bacteria, viruses, and so on. So that I've just given you the list there. So they estimate that those 13 agents are responsible for about 2.4 billion cases of human disease each year, and over 2 million deaths attributed to those 13 alone. Okay. And as I mentioned, then majority of infections occur in poorer income countries, but hotspots are cropping up in developed regions here, Europe, the USA, where diseases, new diseases might be emerging, or old ones that we thought we had put to bed and taken care of might be re-emerging, or microorganisms evolving and becoming more virulent and capable of causing more severe disease or increased transmissibility. We've got issues around developing drug resistance in bacteria. So typically things like foodborne zoonotic bacteria, or TB, the bacteria that causes TB in humans. And it's probably likely to get worse due to the global increase in demand for livestock products going forward. So what we tend to see is, as countries become more, or populations become more affluent, the volume of foods of animal origin being consumed tends to increase. Okay. Okay. And just, there's a lot of data on this table here. Again, this is just impact of zoonotic disease on human health. And this is kind of European data from the last year or so. So it's really just to highlight the list of agents here. So you'll see some of the usual suspects here, and you'll notice that a lot, if not all of them, are transmitted through contaminated foods. And then you'll see kind of the numbers of reported cases for each agent or hazard. So you can see that the numbers are relatively large for some of these guys here on a European level. So you've got almost 160,000 cases of Campylobacter infection in humans reported in Europe. And I suppose the key thing to bear in mind is that their actual official reported cases, the actual real burden of disease out there in the community, is probably magnitudes higher. And if you read through the literature, they would say that it could be greater than 10 times higher than the number of actual reported cases. So when you start multiplying these numbers here by a factor of 10 or a factor of 20, for example, you're becoming much, much bigger and more significant numbers. So a big burden of disease, even within the EU and developed regions associated with zoonotic disease. Okay, so now just the next few slides then, it's just to zone in then on one particular food chain in terms of how we actually try and manage risks and prevent or reduce the risk of consumers being exposed to zoonotic pathogens. And what I've chosen is the dairy food chain, and more particularly raw milk and dairy products made from raw or unpasteurized milk. Okay, so a little bit on the dairy chain in general then. There's a whole list of zoonotic pathogens that can end up in milk, in raw milk, okay? And there's a very strong kind of historical association between milk and transmission of zoonotic disease to humans through milk consumption. So we kind of need an integrated kind of farm to fork approach in terms of controlling or managing risks within food chain. Okay, and just to put into context then, just to highlight to you that the risks associated with raw milk consumption and the possibility that raw milk can contain some of these dangerous zoonotic pathogens. This was a report that was published a few years back in the Irish Veterinary Journal, and it was associated with an outbreak of tuberculosis that affected cattle on a farm and people within the farm family. So essentially you had a cow that was infected with bovine tuberculosis. So this is the bacteria here, Mycobacterium bovis. And she was actually shedding the organism in her milk. And the farm family was using milk from this cow as their milk supply in the household. So they were drinking raw milk from this cow. And also the milk was being used to feed young calves on the farm. And it resulted then in 5 of 6 people within the household being exposed and possibly infected with bovine TB. And it was also found that a large number of calves on the farm subsequently tested positive for TB. So again, it highlights the risk associated with raw milk or unpasteurized milk consumption. And I just have another example here. And this was to do with another farm scenario where you had an outbreak of salmonellosis in the people on the farm that were drinking raw milk. So essentially, the farm family were drinking milk from the bulk tank or the milk storage tank on the farm. So it was raw, unpasteurized milk. And you had 2 of the people within the family becoming sick and confirmed as cases of salmonella infection. And when the investigation was carried out, it transpired that in the days prior to the family members becoming sick, there were a number of cows within the herd that had clinical symptoms of salmonellosis themselves. So typically enteric disease, dehydration, diarrhea, all that kind of stuff. And that milk was still being put into the bulk tank from those sick animals. Okay. And essentially what you have is then the main risk is fecal shedding of salmonella by those animals, contamination of the milk during the milking process, and then ingestion of the organisms through milk consumption. Okay. So so look, most of the milk that we consume in Ireland and in most developed countries is heat treated. So pasteurization would be the heat treatment of preference here in Ireland. And pasteurization is very effective then in terms of eliminating harmful bacteria or pathogens. Okay, so it's probably one of the most effective food safety interventions ever. It really has been a silver bullet, okay, in terms of public health protection. So for pasteurized milk, we have a very high degree of confidence that it's effective and it's safe for consumption and consistently safe. So what about raw milk consumption and dairy products made from raw or unpasteurized milk? So in the last number of years, you know, there definitely has emerged a kind of a niche market for raw milk and people that want to consume it, okay? So we need to think about kind of on-farm controls, transportation of milk, processing of milk, storage, testing, and then kind of the context within a food safety management system. So in terms of on-farm controls then, you know, we have to control, there's a national control program for bovine tuberculosis, okay? And it's caused by this bacteria here, Mycobacterium bovis. So there's a legal requirement that all bovine animals in the country over 6 weeks of age have to be tested at least once a year for TB, okay? And they use what's called this, often referred to as a skin test, right? So the most recent, you know, over the last few years, let's say, there's approximately 20 to 25,000 bovine animals that test positive each year. And that's out of a population of maybe 5 or 6 million cattle in the country at any one time. So it's a tiny fraction of 1% of animals. And any year then, in terms of the numbers of herds with a breakdown or where a positive animal or animals have been detected, 4 to 5% of herds would be affected each year, certainly in the last few years. So we have a national control program, and it's there primarily to protect public health, but also animal health, because TB actually causes disease in the animals themselves. And when it gets kind of progresses in the cow or in the bovine animal, it will become a kind of an economic disease. The animal will waste away and will become unproductive. And it's also very important then in terms of trade, either in animals or in foods of animal origin, you know, to foreign markets and so on. So what happens if a farm, reactor animals are found in a farm? Well, immediately the herd would be restricted. So there's no inward or outward movement of animals within that herd. The positive animals that have tested positive are culled. And then very often the Department of Agriculture will actually follow up with an additional or supplementary blood-based test. And that test is hopefully a little bit more sensitive, and it will hopefully pick up more positive animals that the skin test may have missed. So particularly animals in the earlier stages of infection that the skin test might miss. So to maximize the number of animals that you test positive, to get them removed from the herd so that they're not spreading TB within the herd and maybe animals being sold and moved off to other farms and so on and spreading the problem, okay? And the animal movement restrictions then can only be lifted in the herd once there have been 2 subsequent clear TB herd tests on the farm. And each of those tests have to be a minimum of 60 days apart from each other. Okay, so it's very, very disruptive for a farm when they do get reactor animals, because it'll be realistically, it could be a minimum of 4 or 5 months before they can actually start selling animals or buying in animals since they got reactor tests positive results. So in terms of our raw milk then consumption and raw dairy products. So the Department of Agriculture have a minimum inspection frequency of those farms supplying raw milk for human consumption without any heat treatment, an inspection frequency of 1 inspection at least every 6 months. And rather than the herds being tested once per year for TB, they're tested at least twice per year. So they're additional controls. And also there's an annual health cert required for those herds that has to be signed off by the farmer and the veterinary practitioner that's looking after that herd. And that has to be, that animal health cert has to be sent in and registered with the Department of Agriculture. Milk being sold as unpasteurized raw milk intended for human consumption without any heat treatment can only be supplied from herds that are tested TB-free herds, okay? And they also have to be from herds that are have a low prevalence of mastitis, because mastitis can be a source of large numbers of bacteria in the milk, some of which may potentially have a kind of a food safety dimension to them. Okay, and then there's obviously controls around refrigeration of milk during storage on farm, during transportation to a processing plant, within the processing plant, and throughout the remainder of the distribution chain and so on. And there's also a legal requirement then to test for specific pathogens in these milk samples if they're going to be consumed as a ready-to-eat food. So, for example, things like absence of Listeria, Campylobacter, and Salmonella species. Okay, and then obviously it's important that these businesses, these food businesses, have a food safety management system, and it's open to kind of official audits and regulatory compliance checks and so on. Okay, and then what about very briefly then, raw cheeses? You know, we've moved on now from raw liquid milk for consumption. What about dairy products that are manufactured from raw milk? Again, these have been linked in the past to outbreaks of zoonotic disease in humans. So in terms of the legislation then for soft cheeses, there's a minimum 60-day ripening period before they're actually placed for sale on the market, okay? And that's primarily a kind of a food safety intervention. So it's really, you know, if you've got this little graph down in the bottom right-hand corner, so if you've got pathogen populations in your milk starting out, hopefully during the 60-day ripening period, over time, whatever pathogens are present then, the populations of those will actually reduce, hopefully down to 0 or down to very, very low levels. And it'll become a less risky product for consumption. And that ripening period, then you're hoping, you know, that the conditions that you know, within the cheese is relatively unfavorable for kind of bacterial pathogens. For example, you've got acidic conditions, you've got low storage temperatures, you've got anaerobic conditions, you've got reduced water content through the addition of salt for flavor and so on and so forth. But it's not 100% effective. You cannot guarantee that raw milk is going to be consistently safe, or soft cheeses made from raw milk are going to be consistently free of pathogens. Okay. Yeah. So, you know, I've just given some reasons there in terms of raw milk and dairy products and kind of the health warning, if you like. And anybody that wishes to consume these types of products need to do so with their eyes open, really. You know, the first thing is, you know, in relation to TB in dairy cows, for example, the test that we have available, or the tests that we have available to us, are not 100% sensitive. So it's going to potentially miss some positive animals that will slip through and give a negative test. Okay. Pathogens can gain entry at any point of production and processing. So there's no hazard elimination step. We don't have pasteurization. We don't have a heat treatment step to eliminate bugs. And there's limitations associated with end product testing. So if you have a batch of cheese or something like that, you're taking a little piece of cheese, you're sending it off to the laboratory and testing for listeria and salmonella and so on and so forth. You might get negative results back, okay? But it may not be representative of a large consignment of product, because you've only tested a tiny piece within that batch. Okay, so good laboratory results telling you that it's come back listeria negative or salmonella negative can potentially give you a false sense of security in terms of the safety of your product. Okay, and I mentioned then the 60-day ripening period. It may not be sufficient for some pathogens in terms of them dying off over time. And there have been past outbreaks associated with these in relation to salmonella or E. coli or listeria or bovine TB associated with these types of products. So it's really the controls that are in place for these riskier products. It's really about risk reduction rather than risk elimination measures. Never going to be as safe as pasteurized milk or dairy products. And we must kind of accept some kind of residual inherent risk associated with these foods. And there's a need then for kind of product labeling so consumers are aware of those risks, and probably consumer awareness of those risks to generate increased awareness of those risks and so on. Okay. And just finally then, just on a positive note then, just don't forget all of the positive associations of animal-human interactions. And that also comes under kind of the One Health banner. So you've got kind of the socioeconomic benefits, farm families, the agri-food sector, all of the employment and income it generates, the national and rural economies, etc. The foods that we obtain from derived from animals, and the nutrition and part of a healthy, balanced diet and so on. The social and recreational benefits associated with pets, sport animals, and kind of the mental and physical well-being associated with their kind of interactions with animals and so on. So I'm going to leave it there. I think that's more than enough as an introduction. So thanks very much.